So myeloid leukemia is a lethal disease, mostly affecting the elderly. Our team knew that a subset of patients gets almost an earlier form of what's called the dysplasia. It's where your blood cells grow but aren't exactly cancerous. The reason that was important is that we know about a third of those patients actually will get this lethal form of acute myeloid leukemia, but we had no idea how to determine which ones would get it and which ones wouldn't. What our team was able to do was to create a model where we could actually see what we had seen in the patients. We could actually see a stepwise progression from a normal cell, which is really our underlying question. How do normal cells become cancerous? We were able to show that there is a step that's similar to myelodysplasia you see in patients, and there was a subsequent step into acute myeloid leukemia. And that was really an important finding because it gave us a tool to shed light on the idea that there are steps, in fact, that these observations we see clinically aren't anomalies. But we wanted to really test whether our findings made sense in actual patients. So we were lucky enough to establish a collaboration with a group in Italy who's been collecting for almost a decade now samples of patients that have this hyperproliferative stage of the disease, and then some of them, about a third of them again, succumb to acute myeloid leukemia. And what we were able to do is check that in those steps, the genes that go up or down, from the first step into the second step to this lethal form of leukemia, in fact was exactly what our tool had predicted. So our tool gave us an instrument to measure that staircase toward leukemia in a way that we really never had before. So I think our next steps are twofold. One is we want to take these steps that we've defined now and apply them to patients that are presenting with myelodysplasia right now, both here in Canadian hospitals as well as some collaborators in the United States. And I think moving forward that will really demonstrate to us if this stepwise process is something we can apply in a general way to far more patients in the future. So we're excited about that ability. I think the second thing is that currently acute myeloid leukemia, the therapy really hasn't changed in decades. And we know some of these patients that get this pre-stage of leukemia, we understand now these steps, so we know what genes are turned on and what genes are turned off. So what we want to do is now target those genes. We want to not only be able to predict, but we want an intervention therapy. And the exciting idea is that some of these genes can be targeted with existing drugs that are actually not used for cancer, but used for other indications that we now want to bring to these patients in hope that we can not only predict which patients will get acute myeloid leukemia, but hopefully prevent it altogether.